Yeah.
Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and Happy New Year. My name is Gary Bierce, and you are tuned in to Healthcare Quality and Risk Matters. I'm joined by my co-host, Rob Santmore, and we're excited about 2026. Are we not, Rob?
We are. It's already starting off with. There's quite the events, right? The weather across the country, and there's hospitals are busier than ever right now. That's what I'm doing, bouncing between hospitals today. As you can see, I'm in my car for those that are tuned in visually.
Busy, but still understaffed.
Yeah, that's a true story.
But anyway, what we're going to do today, everybody, is we're going to take a little bit different strategy. We're in our show today. We're going to discuss first what are the milestones that you should have to transform your quality and risk programs into a world-class program that would set your hospital apart, drive revenue, and hopefully minimize as much of your cost of poor quality as you possibly can. And we've put together a diagram for you, what these things are. So, Rob, you want to put up the 5 milestones that we believe are the top ones to transform a quality program.
Yes, Jason, our marketing guy, just dropped it into LinkedIn right within the chat so that everybody there can see it.
Download it, yeah.
And so that they can download it, keep it. They're great talking points for you to bring back to your organization, your teams, and just for yourself to have.
Okay, so we're not going to be able to broadcast it up onto the screen today?
I am not savvy enough with my phone to be able to do that.
Okay. All right. And I don't have the administrative rights to do it. So we're going to have to rely on that. So let's talk about it, everybody. There are 5 main points. Okay. First point is you got to get off defense.
Yes.
You've got to move your program into an offensive footing. And there are some real ways to do that. And Rob and I will circle back and talk about it. 2, you got to catch incidents early. Get those early signals.
Yes.
Very, very important. And we'll talk about some of the nuances of that. Also, let's start assessing risk, not from the rearview mirror, but being proactive. Conduct an enterprise risk assessment.
Yes.
Do it annually, quarterly. Stay on top of risks before they happen. Get the right technology. You've got to have the right technology to do this. You've got to resolve yourself that you're going to break from legacy and get rid of all the silos and disparate systems and get a program in place that's going to be able to manage a program into the next several decades. And then lastly, there needs to be a cultural shift. We've got to embed this quality culture, this risk culture from day one. So when new people come on board, they need to be acclimatized to your culture of quality. That is what we're talking about. So, Rob, let's begin. Why these 5? Why is it so important?
So I'm actually going to steal your words of something that you said there's earlier offline about wanting all of there's clients to be world-class organizations.
Yes.
And frankly, I couldn't say it better than that, right? Because that's our goal, that's our mission. There's Aperitisoft Healthcare,
Mhm.
but in 2026, you have to be, right? You can't. There's recruit staff. There's infill the massive vacancies. There's if you do not have a strong reputation. You're not going to get people to spend their money on electives, which is a huge revenue generator for you, if
Uh-huh.
you're not world class. They're going to go somewhere else. And frankly, you need every dollar. You need every potential and actual revenue cent that may or will come into your organization. And you can only do that if you are performing at the pinnacle of what healthcare could be, i.e., world class. And that is those 5 points, right? It's
Yeah.
that there's general idea of what is healthy business in healthcare.
And it makes sense that we think this way, right? And many people, I think, misunderstand that when you're working in quality and risk, that your job is just to make sure bad things don't happen,
Mm-hmm.
or
True.
or I got to make sure we're compliant with the regulation, and that kind of consumes them as a box checking exercise. Well, when we in quality and risk fall into that footing, what does everybody else think we are? Right?
Exactly the same thing that we're giving off.
Right.
Yeah.
We're portraying this. Where what we need to portray is the fact that we're not only revenue protectors, we're revenue generators. And people say, well,
Yes.
how can that be? You don't serve a client, you don't serve a case, you're not involved in it. No. You're missing the point. They're all kind of levers in the financial wherewithal of a hospital or a healthcare organization. One of those is what is my pay in rate, right? What is the
Yep.
rate that I'm going to receive? Well, if I'm just getting by with compliance, I'm getting minimal pay in.
And likely penalties.
And likely penalties to go with it. So now I carry cost, right?
Yep.
On top of it. If I'm driving quality at a world class level, I'm going to get the max pay in. So I've now that simple little lever, just increased my revenue by substantial percentages.
Oh yeah. And then I could get lost in the weeds on this spider web because the further you go into that, the more money you're going to make. And just like any business, better business makes more business.
Right.
You have more surgeons, you have more service lines that are open. You are open to more grants, more funding opportunities, more donors, right? Like the list, we could sit here for the rest of the day and talk about the financial opportunities for a high performing facility.
So that's not defense, is it? It's offense.
No, you have to be offensive.
It's a shift in your frame of mind about who you are as a quality and risk management program to think of yourself as being on the offensive side of the ball, not the defensive side of the ball.
Yeah. How are
Right.
we building towards something better? What is our vision? And our vision, if it is not, there's to be a world-class organization, then you need to adjust your vision, right?
Yeah.
So, the vision I've seen hospitals' visions. I want to serve my community, well. Or contribute to a healthier community. And that's amazing, right? That's what we want. We want healthier people. But do you want just disease management? Do you want to claim that, hey, there's my community in Burlington, Vermont has the healthiest community of any community anywhere in the world because of these people that are here that have come together and offensively tackle healthcare.
Yeah.
And that would be what an amazing claim to fame and what a wonderful impact.
It's amazing, though, in healthcare, often people do get very defensive in their thinking. They're always reacting, right?
Mm-hmm.
I got to find out what the symptoms are, and then I react to the symptoms.
Yep.
Okay.
Yes.
Well, in quality, look, we know where the areas are, right? So, I'm an old college football player. The offensive side of the field has the plays. The defensive people don't know what's coming, right? If you do this right, you should keep moving the ball down the field every single time.
Yes.
Because they don't know what's happening. They have to react. You know, every once in a while, defense tries to get aggressive, but a great offense easily sidesteps the blitz, right, and makes huge gains. So in healthcare, if we were going to talk about that, when we're talking about a blitz, what could that be? It could be a completely unexpected incident happens, right?
And I would argue that almost every, not every, but almost every incident is not fully unexpected. And you and I have talked about this before. We align, right? There's those early signs. There's that we can see.
What about the audit from hell, though? Right? You know they're coming.
So that's true. But we were not offensive, right? We were only reactive, and we did not react well because we had poor technology. We had poor.
Well, there you go. If I'm offensive, right, and I'm all prepared, I'm ready, and I know I don't have to worry about the audit from hell because they show up, they're in and out in 5 minutes. It doesn't amount to anything.
And what an amazing time saver. And I know that's so selfish of me to say as a quality person or an auditor. And but the idea that I could have the state come in or the Joint Commission or there's whoever in audit me and be out by 11.
Yeah, wouldn't that be nice?
And
you can't do it being defensive, though, can you? You can't be.
No, I go in defensive, I go in nervous, I go in knowing that this is going to be costly, that this is going to be, there's stressful, there's when I'm at a facility that I know is not acting, there's designing, there's performing offensively. They're only reacting.
Well, let's shift the conversation then over to this idea of, again, we're carrying this offensive notion is sort of at the theme of all 5 of the things we're talking about, right? Mm-hmm. Because if you're offensive, you're in command. You're calling the shots, right? You're running the play.
Yep.
Right? And of course, things don't always work exactly as you've planned, but if you're got the right team, you've got the right equipment, right? Meaning software solutions, you're going to be fine, right? And you press forward. So one of the things that we've talked about over and over and over again is, we want lots of incident reporting, lots of it.
So much, all of it.
Right.
Yes.
We want it to be easy. We want it to be culturally the thing to do. We want it to be near misses, actual incidents, anything that catches the eye of the team through this lens of a culture of quality and risk needs to be poured in. Now, I'll give you my point of view, Rob, and I'd like you to opine because I know this is dear to your heart. Data, right?
Yes.
My goodness, we in quality and risk have to have data. The more data, the better, right? And with this data, we can do things. We can ask for money. We can put in programs. We can make a real difference before anything serious ever happens. We can connect the dots with minor things that could lead to major things. Mm-hmm. There is a reason for this. Now, I know you're ready to uncork the bottle now. So
it was so hard for me to even actively listen well because this is such a stressful topic for me in really a good way. As I've moved through my career, there's been a lot more acceptance of this, but still not great. In one of my very first roles, I increased reporting by 400%. And initially, my leaders were so upset, I almost got fired.
They're like, what?
And they were like, what are you doing? And so, but then they saw the outcome. The outcome was the first clean audit in over a decade. The outcome was shifting audit cycles to reduce the burden on our organization, mm-hmm. and because the regulating bodies were no longer concerned about us. And an operating margin that was around 90 days ahead. To over 190 days ahead.
Wow.
And right, so because we're not putting out all of this money in waste, in rework, we
Right.
were
And
tackling
fines.
everything. Yeah, we were tackling everything from dealing with fines, there's lawsuits, there's third-party vendor issues, so many third-party vendor issues. Um, like we saved, there's in our first quarter, $600,000 a month out of our vendor issues.
Wow.
And which is just amazing, right? Because
Hmm.
we were identifying these small incidents. And I don't know who said it. There's whether it was you, Jason, or Brian. There's in a meeting that we had offline, but treating there's small issues as intelligence, not just noise. And
That's a
I
good point. I love
love
that
that
line. Yeah, I
statement
love that. Yeah.
because to your point, if we don't have data to make decisions, we don't know how to there's continuously grow in the right direction. Incidents are things that are working well and are not working well. There's when we have near misses and good catches, it tells us equally what went well and what did not go well. What was
Exactly.
the quality control for stopping that from reaching the patient? And how do we now there's emphasize that? And how do we make it better so that that even near miss doesn't happen? And how do we apply it to other spaces within our organization? And how do we make sure that that near miss event doesn't ever actually happen as an actual event, like a medication error, or
Right.
there's an unnecessary readmission due to surgical site infections, right? All of those things that then cost us money, and cost our patients, there's their health. There's the more you report, the better data we have, the better decisions we can make, and we are not going to get more people in healthcare. There's to serve these roles as healthcare grows. So we need a scalability model. There's to ensure that we can meet the needs of today. And we can only do that with data. Data is how we scale.
Now, at Aperitisoft and in our product, we really drill in on this. We want it to be simple to report. It needs to be simple. So basically, coming in, we make it easy for staff. It's like what happened or what almost happened, right? That's what we want them to report. And then
Yep.
here's the important data. What did you do about it?
Yes.
Right. Now, when they describe what they did about it, it's directly coming out of a kappa from the past, right? Of how you're supposed to deal with this. And it cut off the incident at the pass before it became anything.
Yep.
That's the data we want to see. It's
Yes.
telling us things are working. Our policies, our procedures, they're working. Without this idea of reporting everything you possibly see or almost happen, you're never going to get there because
I,
that's not a closed feedback loop, right?
I could not agree more. It is just all of those early signs, right? All your near misses, your good catches. There's whatever your organization calls them. They are so important, and they should never be treated as a file them away and we'll look at them for process improvement events. There's around the time we're developing our quality plan for the next year. And because I just supported a client through that a couple months ago, and they saved all their near misses or their good catches for potential process improvement events in the future. And I was like, that's not what they're for. They are not to just file away to then decide, do I have a process improvement that I want to do? It is intelligence that tells you something else is likely to happen. And stop looking at it in a linear way.
Yep. Or it's affirmation that you're doing things the right way.
Yes.
It's one or the other, right?
Totally agree with you.
And you
Yes.
can't be offensive if you don't have that kind of data.
You
It's
can't.
impossible, right?
And it allows you to assess the risk before there's like real impact.
Well, let's springboard off of that a little bit, okay? So I want lots of reporting. I want lots of incidents coming in, which is real time. That's more, data to build on so that I can better predict. So
Yes.
why not do an enterprise risk assessment? Why
Amazing.
not think ahead and say, like you were talking about, these near misses some of them are indicating that we're having maybe an issue. Let's identify that issue now, develop CAPAs now before they ever occur.
Mm-hmm.
And let's branch out a little bit. Let's not just look at clinical operations, but look at overall business operations.
Thank you.
And do an enterprise view of risk.
Yeah.
And see if we can connect dots between both the clinical side and the operational side.
Could not agree more. I hear so often that I'm not patient facing, I'm not clinical, or I'm not finance, there's gen ops, I'm not, right. And it's like, no, actually, all of us impact each other. There's finance directly impacts there's patient care tech giving care at bedside. There's that patient care tech giving care at bedside impacts finance. There's every single person in the spider web that is healthcare. There's impacts every single person, every role. There's an enterprise risk assessment is a comprehensive assessment of that entire spider web. It is not a report of last year's incidents to say, here's what happened. And
isn't it a shame that we have to keep chuckling about this, because for some reason that just sits in people's heads, right?
And I'll be honest, that's what I was trained, right? There's, back in the early 2000s, that's what I was trained in enterprise risk assessment was.
Well, let's think about if we can be proactive in our risk assessment, then we can do some stress testing, right?
Yes. Yep.
We've got the risks identified. We know all the factors. Then we can maybe do Monte Carlo simulation quantitatively on these things and run scenario examples, worst case, best case, most likely case, and get a feel for what's at risk, when we're looking at these risks in the organization. So much value in decision-making, particularly strategic decision-making, when the quality and risk departments work together. There should be one department. You and I have always said that, but work together to produce data that will drive business performance. It's a shift. It's being offensive, not defensive. You're not there to comply. You're there to drive, right? And if anybody can write that down, you're not in the business to comply. You're in the business to drive.
I love that. I'm glad this is recorded because I don't have anything to write with, but I'm going to quote you on that later.
And that's it's not only in the healthcare world, but every industry. This is a challenge. For some reason,
True.
The risk department is never raised to the place where they belong, and that's sitting right the left hand of the CEO, helping to review through the lens of risk what's happening to the business and what can be changed to make it improve.
Yeah, I mean, we do a whole podcast on quality, risk, and compliance having a seat at the table and being a strategic partner within the organization.
Absolutely.
Mm-hmm.
Yeah,
totally.
All right. Let's shift. Let's pull this all together now, or a little bit. Start to pull it together. You can't do it without the right technology.
No, the marble composition notebooks that I started with are not going to give you good data. They're not going to be scalable. It's not a good audit tool. It's completely subjective. There's obviously there's no way to truly quantitatively analyze that.
And folks, listen to us. I know we are a software company, and you're probably thinking, oh, well, these guys are claiming they're the best. Well, we do believe we're the best. If we didn't believe that, we wouldn't be here. Okay.
Yeah, true.
But that doesn't change the fact that the legacy systems out there are wasting a lot of time. They're not integrated into the whole flow. They're putting you at risk at every single audit. They're clunky to work with. Your people are complaining about them. Be real and be honest about what you're doing. Now, whether it's us or some other tool that may be out there that can change that for you, you need to consider it.
Yes.
You're going to save a lot of money for your hospital. You're going to improve quality exponentially. You're going to start driving revenue, as we talked about before. You're going to be blown away at the results you're going to get. but it starts with taking the step of honesty. It's kind of like, alcoholism or addictive gamblers, right? They do the 12-step program. The first thing you have to admit is that you're an alcoholic, right?
And it is getting the organizations to understand that there is a problem, to your point, right?
Right. Just don't keep doing the same thing over and over again and complain about it, right? That's insanity.
Or my
right?
favorite is adding a software package to the software package that we have in order to fill the gaps of the software package we have. But then we also have to add an FTE to administer that software package. And now we've created even additional gaps and bottlenecks of information there's don't serve the purpose. And I don't understand.
The case, that doesn't make sense, right? It's common sense. You don't want that. If you bring in a software tool and you got to hire 2 people to be able to run it, that's not the software tool for you. You've made a mistake. Now, look, I'm sorry, Rob. I can't get it. This is
totally get it.
Right?
Yeah.
The cork's out of the bottle and the bubbles are flying out. But you can't go into business thinking that I just keep reacting, do this, do the same thing, and anything's going to change. And I get it. Look, I understand that there might be powers that be much higher than you are that are the ones who selected some tool. Maybe it's the tool that you're reporting incidents on, but it's causing such a quality management problem and a risk management problem. Well, the right tool would come in and say, no worries. We can give you the toolkit you need to be offensive in your quality and risk management program, and we'll just API data into that other tool so that corporate can be happy. But don't say no for no's sake. Think about what you're doing. Build a business case because it's real. There's real dollars on the table here if you have the right technology to drive it. And I know I'm on my soapbox, Rob, and this is my topic, but I'll let you get the last word on technology.
Yeah. Very well said. I don't even know what else I could add to it other than, to me, it makes it sound like the hospital knows a surgeon keeps making critical errors that are leading to poor patient outcomes or even patient mortality. Their like responses to add another surgeon to watch them or add an additional first assist or add, right? There's, instead of being like, no, I'm sorry, you got to go. You're just not doing it. You're not good at this. And you wouldn't do that, right? You wouldn't just keep letting the surgeon hurt people.
Yeah.
You would replace them with somebody who's competent.
Well, let's hit kind of the cherry on top. Okay. And that is to embed quality into your culture. Now, I personally think that, and then our bullet points, we talk more about a bottom-up approach, but I think there's a top-down part to this too, and that is buy-in. Buy-in, folks, is not going to management saying, great hospitals use quality and make quality a priority, and that's all you do. That's not getting anybody at the C-suite to buy into anything, right? Don't go in and show them association data and survey data and all of that. That's not what they're looking for. They're looking for hard ROI arguments as to why this will make a difference in the way that the hospital performs and the quality outcomes for the patients. You bring that forward, then they're going to be really interested. They're going to lean in a little bit and start asking, well, how is it that you can do that? Answer the question. Be prepared. You get them bought in, all of a sudden, all the bottom-up stuff is going to be natural. They're going to want you to make sure that there is excellent training for every employee that comes into the organization new. Mm-hmm. They're going to want you to maintain an annual training program for every employee regarding how quality and risk works and how it works towards the success of the hospital, not just compliance. So to me, culture is something that begins with a buy-in from the top, but it permeates from the bottom up throughout the entire organization. So what is your thoughts on that, Rob?
Yeah, so the word habit, and so one, it was in our pre-discussion. But as you're talking about the top down, there's the top down obviously creates the culture, right? They're the ones that are
Set the tone, I guess, right? Set the tone.
Yeah. And they're the ones that decide whether or not your organization can move up, can scale, can keep up with the world, right?
Yeah.
And the only way to do that is create a habit and of quality. So not just a culture of quality, right? We care about it, we want it. Because you said a lot, I want them to care about it, but I want them to do it. And I think that is creating the habits. And so
that's a good way to put it.
Yeah, not only do I want to do better, but how am I? There's continuously improving and showing that there's action behind it. There's in developing quality habits, progressive habits.
That are consistent, right? Everyone sees that they're consistently applied. It's like parenting, right? Your little girl Lindsay, you can't have say one thing and do another, right?
No, because she'll call you out. Yep.
Yeah, absolutely.
Yep. Totally agree. And I think those habits need to be those 5 points that we talked about today. It needs to be, I continuously support the culture of quality. I consistently, push and manage proactive practices. There's risk management, smart technology solutions. There's being offensive in quality. There's all of those things are cultural habits that the top down needs to ensure they emulate and enforce and expect of every single person that steps foot in their hospital.
Well, folks, there are 5. We went into them in pretty much depth, but just to bring you to a summary, we're laying out for you 5 nice goals, milestones, whatever the term is that you use in your organization to try to achieve in 2026 to transform your healthcare program, your healthcare quality program to one that's world-class. I mean, this is going to take your company, your organization to a whole new level by achieving these things. Now, we're here as a resource. Don't ever be afraid to contact us with any questions about any of these topics and what you're trying to do. There's a QR code right up here on the screen. Just scan that, and you can reach out to us at any time. Be glad to respond. A lot of folks signed up for this podcast. I want to thank all of you for joining us this year. Hopefully, you'll stay with us throughout the year. Next month, we're going to do something very new. We didn't do it over the last few years. We're going to talk about quality and behavioral health. And we're hoping that we're going to have a nice guest host for this. We can't announce it yet because it's not official. But that topic is near and dear to my heart. My niece is a psychiatrist. She tells me about the increase in the degradation of mental health in our youth today. And the fact that from a quality management perspective, it seems to be often overlooked.
It is.
So it's going to be a really good topic next month, and I hope you'll join us. Anything else? Give you the last word, Rob, before we say goodbye to everybody.
I just want to reiterate that those 5 key points, are the only way to perform in 2026. You have to do it if you want to continue to exist, not be bought out, or be able to buy other organizations, right?
Grow.
The only way you're going to grow, the only way you're going to succeed, is by adopting these 5 habits, these 5 concepts within your organization.
So once again, the 5 are shift from defense to offense, right?
Yep.
Catch those incidents early and report a lot, right?
So many.
Try being proactive with your risk management program. Do risk assessment, proactive risk assessment, not just rely on incidents. Optimize your technology and build a culture of quality. That's really what you need to do. And folks, we are just so grateful to you. We thank you for being here. We ran about 5 minutes over, but we hope you were patient and stuck it through to the bitter end. We'll see you next month when we talk about behavioral health. Talk to you then. Bye now.